So, madam, we are live now. So, good evening, doctors and all the participants. I Shuman on behalf of Shield Healthcare, welcoming you all in today's session, a very interesting session on impact of stress on infertility. And our guest speaker is Dr. Maya Mukhopadhyay, madam. Before moving into the session, let's have a look on our Shield Connect platform, which is a knowledge sharing platform of Shield Healthcare. This is basically the knowledge sharing platform, that is Shield Connect. Here you can find many blogs written by many eminent doctors across India in different topics as well. And here also you can find different webinar, that past webinar and the present webinar also. And here you can see the tentative schedule of the upcoming webinars as well. And the most important thing is our key opinion leaders. So presently more than 1,000 doctors are currently supporting us, this knowledge sharing initiative of Shield Healthcare. So this is typically dedicated to the medical science. And now it's time to start the session with madam, and it's our honor to introduce madam. First of all, we would like to convey our sincere thanks to Dr. Maya Mukhopadhyay madam for her valuable time on our platform. She'll connect to discuss such an important topic, that is impact of stress on infertility. And madam is the senior consultant gynecologist and laparoscopic surgeon. She is a specialist in Department of OBGYN in Bahajatin State General Hospital, Kolkata, West Bengal. And I would like to request all the participants for your active participation, and please drop your questions on the dashboard of the Shield Connect page. So once the talk will be over, we can have a short discussion on this important topic with madam. So thank you very much all participants for participating in this webinar, and thank you very much madam once again for your valuable time on our platform. And over to you madam for further proceedings. Thank you very much.
Good evening, ladies and gentlemen. Let me first welcome you on this platform where we're going to have a short talk which has been hosted by Shield on the topic, very interesting topic actually, impact of stress on infertility. Now, after 2 years of remorseless suffering with the corona pandemic, it's not very pleasant of me to start by saying that maybe infertility is an epidemic. But unfortunately, it is true, because the incidence of epidemic is increasing so strongly globally. Like 60 to 70 million couples in the reproductive age group have infertility issues all over the world. 1 in every 4 couples in the developing world is affected by this malady. In India, nearly 15 to 20 million of couples are infertile. That means of the 60 to 70 million all over the world, nearly 20% are there in India itself. And of these 15 to 20 million couples, a very small amount, that is nearly just 3 million people, are actively seeking medical treatment. So actually today we're not going to talk about the causes of infertility or its treatment, because I guess everybody in this August audience will be knowing more or less, how to treat infertile patients. But I would like to stress on something which is a part of every cause of infertility. I mean, like, we know that infertility has several causes, of which we know the ovum and the sperm and the passage and the hormonal milieu and so on and so forth. But there is one common factor in all the causes of infertility. And I think we have been, to a certain extent ignoring it, because we try to concentrate more on the medical and the operative treatment of infertility. And that X factor in infertility, I guess, should be considered as stress. Because in the lifestyle of today's young couple, stress plays an extremely important role. I mean, like, people have got one target in mind, and that is a career. Second is their finances. And thirdly, it is, if I may say so, to a certain extent, entertainment. I mean, like, the weekends of a very, very busy couple are usually, spent in clubs or drinking and dancing with friends. So they really don't have time much for each other. So in this world of today's fast and, very fast-paced activity, I guess stress is a very, very important factor as one of the causes for all the causes of infertility, if you can understand what I mean. So when the person, how does a couple react to this news that the couple is infertile? First of all, when the couple does come to us, the very first visit or the second visit, we will not declare that the patient is unable to or is subfertile. We will first give all the string of investigations that we normally do. And after that, when we realize that something is wrong or something is not wrong, the worst part is those patients when nothing is wrong actually. In those cases, when we have to bring forth the news that, yeah, thoda time lagega, you may have to wait and you may have to go for certain investigations and tests, then this news, as because time is getting no good news for them, then this preliminary treatment, more and more invasive treatments are suggested that brings in the stress factors like pain, fear, worries regarding the high costs, resentment and isolation from family members in case of the female partner, envy, etc., because some relative may be having 3 children and she has got no child. And so there's a kind of disparity between, relatives. So all these things cause a turmoil in the minds of both the partners. In cases where there's no palpable cause, that is much worse because the infertility means a hopelessness and the loss of motherhood can be very distressing and debilitating. And the worst comes when marriages break, where mostly the male partner in our societies, they opt for another wife, thinking that possibly yahan nahi hua to shayad second marriage se ho jayega, whatever they are missing. I mean, this is really something which is totally illogical, but people are doing it. So what are the reactions when you tell an infertile couple this is bad news, and what is the reaction to being bracketed in the infertile group is very varied in couples. Most start by thinking that it is a minor issue, which in time will respond to treatment. Many get overly worried, especially the older age group couples who need quick results. And as the investigations bring forth the results, there is hope that the problem or the problems can be corrected. Denial is also a very big, reaction to infertility diagnosis, and especially on the part of the male partner in our society, because and his family also, because they don't want to be, they don't want to be the cause of such a big thing as unable to procreate. This is like a big insult on the part of the male partner. So denial is also one of the few reactions that a couple can, express when they are told that thoda problem hai, that you can have an issue with being fertile. So now we have come, go back to the kindergarten stage of our MBBS. We all know what is the physiology or the physiological changes that happen in stress. Tachycardia, tachypnea, increased blood pressure, increased muscle tone, sweating, blood flow to the brain is increased, and the splanchnic circulation is decreased. Now, all this doesn't mean that an infertile couple is going to have all these things. I'm not trying to say that. I'm just trying to say that these are the general reactions to stress, because these kind of reactions make the body fit for fight or flight. You know that. We know all of. So what happens is that we have to, when we're talking to a couple who's infertile, we have to understand, through the mannerisms of the patient, through the history of the patients, the couples, we have to get some idea that possibly a stress factor is working or may be working. So this is like in medicine, we say now that you have to be you have to be, what do they call it? When you want to diagnose hypothyroid, you have to be hypothyroid minded. And in gynae, we say that if you want to diagnose ectopic, we have to be ectopic minded. So in the same way, if you want to catch on with the stress factor, we have to have some idea or some inkling while watching the patient or while talking to the patient that there may be some symptoms that suggest stress. So I've just, divided these symptoms as the first one being psychological. The patient may look depressed, may look in a very, depression, isolation from social functions. From the history, you'll find out that the female partner or the male partner, either of the two, they don't like to go to social invitations. They don't like to mix with their family functions. They like to be they want to be isolated. Then the second is introvert behavior. They don't want to, tell, they're not very extrovert. They don't want to tell all their feelings, what they are feeling, what they are going through. They want to keep all that, hidden behind curtains. And there might be some people who show anger issues, not in the chamber, of course, but at home. They're having tantrums. They're refusing to comply with treatment and refusing to comply with many things, whatever society demands of them. So these are the psychological symptoms that if we get a chance of finding out that these may be there in the couple, then we might understand that it is possibly a fallback of the fact, a stress factor that is working after that, after the news that she's infertile. Now, behavioral symptoms are also very common. In fact, these are more common because the male partner always tends to go to things like smoking, alcoholism, because they think that, they can release their emotions and release their feelings over there. But it is like a vicious cycle. The smoking and the alcoholism itself will go back and cause the same problems, or rather aggravate the problems of infertility that was already existing. So behavioral problems are there. Even the female can take to smoking, alcoholism. Nail biting. If you see a couple in front of you and you find that one of the partners is, nail biting all the time and, very nervous to talk about her history, very nervous to talk about what is wrong with her, then that can be considered as one of the behavioral changes of stress. Then she'll also give a history of disturbed sleep, getting up in the middle of the night, nightmares, bad dreams, eating disorders. Now, eating disorders is very important because, as we know, this eating disorders is one of the biggest cause of PCOS symptom, and that itself will cause infertility. But eating disorder is what we call comfort foods. A person who doesn't get comfort anywhere else always tends to eat or overeat because they are getting that comfort from the food that they like. So that is also an eating disorder. That is also a symptom of stress and eating disorder. Next, there are some physical symptoms that the patients, mostly the female patients, will complain about, which are not necessarily corroborated by the doctor, because they are all subjective. They are not actually there in a physical body as such, but that's just because of her tension and because of the agitation that she wants to bring out some, some expression. See, the doctor should understand why I am infertile. It's because I'm having a chest pain. It's because I'm having difficulty in breathing. It's because I'm having a stomach ache, an abdominal ache. They keep on talking about all these things. I have seen when patients come to the clinic, the female patients particularly, they will always talk about the fact that the menstruation is disturbed. They want to bring the attention of the doctor to certain physical symptoms in their body, just to show that kuch problem the hai, and if you correct those problems, then definitely I'll become pregnant. So they have these symptoms which are not corroborated by doctors. They'll like chest pain, difficulty in breathing, headaches, fatigue, fainting attacks, sometimes hysteria. This fainting attack is very much hysteric. Maybe a part of attention gaining technique or what, I don't know. But then these kind of things happen, which actually have got no physical basis, but they are all subjective. A body ache of no definite area of origin. They come to the clinic and say, amar ekhane kin hoche, amar okhane tin hoche, pin hoche, all these vague terms that none of us understand what it means. But it generally signifies that she's just trying to she's just trying to bring your attention to her physical disabilities, which might be a cause, she thinks, of infertility. And so physical symptoms are some of these. Now, how does stress affect fertility? Now, we have already talked about the fact that stress is one very big, important negative factor in the etiology of fertility. But then how does it affect fertility? Stress, as we know, will of course alter the sexual function of the patient. That means the male and the female. So sexual dysfunction is very important. Next is hormonal imbalance. So many stress factors will change the hormonal balance in the body and then cause infertility through different cycles. We'll come to that later on. Male factors like multiple sperm defects, that is also one reason. Stress acts on the sperm manufacturing from the testis and causes multiple sperm defects. Disturbed menstrual cycle, as we all know in our gynae practice, we've always regularly come across such kind of patients who are disturbed even on account of an examination, and then they will have disturbed menstrual cycle. After the board exam dilo and made 3 mas mashik bondo hoye gelo. So this is very common. Affects implantation and affects the outcome of IVF adversely. This IVF is important in the sense that it is the most stress-producing procedure, I think. When a patient has to go for an artificial reproductive cycle, she's undergoing terrible stress of, giving the egg on time, having sexual relation on time, and all this it affects the outcome of IVF very adversely stress. So what is the process why stress operates? We have 2 axes in the body which are very important. One of them is the HPA, or the hypothalamic pituitary adrenal axis. Any stressor factor meaning all those factors that we have just talked about, anger, emotion, pain, whatever. So any stressor factor will lead to an increased corticotropin releasing hormone from the hypothalamus, which will lead to an increased release of ACTH from the pituitary and consequent increase in the glucocorticoid secretion from the adrenal. And this readies the body for all the stress coping strategies. And when the strategy and the stress has been over, then they send negative feedback to suppress the HPA and when required. So this we all know from our basic education in medicine, that this is how the HPA axis works. Now there's another axis which is of very great importance, that is the HPG axis, or the hypothalamic pituitary gonadal axis. This works regularly irrespective of stress. This is working 24/7. What happens, the hypothalamus secretes pulsatile GnRH, which stimulates release of LH and FSH from the pituitary, which in turn releases ovarian steroids, and that can control the different stages of the menstrual cycle. As we all know, the secretory phase, the proliferative phase, the secretory phase, ovulation, and ultimately fertilization. So this can be done by both a negative and positive feedback, as we know. Now, what happens in stress? In stress, what happens is that there is an interaction between the two axes. If the two axes are acting separately, it's fine. But as soon as stress comes into the entire scenario, the interaction starts between the two axes and the whole thing gets disturbed. What happens is that the corticotropin releasing hormone now can directly inhibit the GnRH pulse generation from the pituitary, leading to a decrease, from the hypothalamus, leading to decreased FSH and LH levels. The glucocorticoids that are secreted from the adrenals, they can also directly act at the level of the pituitary to suppress the gonadotropin release and thereby suppress steroidogenesis from the gonads. So both the axes are now interacting, and corticosteroids particularly are creating havoc. They are not allowing the HPA axis to work as scheduled, and naturally, obviously, therefore, everything starting from A to Z is disrupted. The latest experiments on rodents by endocrinologists across the world have shown that there's a stress-induced increase in the sympathetic innervation of the ovary. The ovary tends to get highly innervated because of the stress, and that can possibly lead to development of follicular cysts and consequently polycystic ovarian disease. So that is another very big factor that will play a big role in causing infertility of the patient. Stress and male infertility is also related, of course. Stress causes a lack of libido in males, erectile dysfunction, failure to perform. Activation of the HPA has an inhibitory effect on HPG, leading to decreased testosterone, causing detrimental changes in the Sartori cell barrier, or the blood testis barrier, as it is sometimes called. Now, this Sartori cell barrier is a very interesting barrier. It is a physical barrier, as you know. It is imperative. It is a very important barrier, the Sartori cell barrier. It is very important because it maintains the adluminal environment, which helps the germ cells to develop in the tubules to form healthy sperms. And if this barrier is disturbed somehow, then there'll be leakage of semen antigen from outside into the circulation, as well as noxious substances from the circulation will enter the tubules. So this is prevented by the Sartori cell barrier. But what happens? This barrier is not destroyed, but is changed by the corticosteroids. And so what happens is that a lot of antigenic material of the germ cell maturations will enter the general stream and will generate an autoimmune response, causing self-destruction of the sperms. So this will again cause definitely infertility. Stress and female infertility, as we know, and we have talked about it very frequently in the past, three things are affected by stress. One is the oocyte quality. The second is the endometrial receptivity. And the third is a disturbed menstrual cycle. We know all about this, but we'll just have a refresher course on it. What happens when the stress is acting on the brain? You can see in the figure here. The stress causes changes in the hypothalamus and pituitary, as I just said, releasing a lot of glucocorticoids from the adrenals. And these glucocorticoids will act and decrease the production of steroidogenesis, estradiol, and that will cause reduced growth and development of oocytes. And the other way, on the other side, the stress is also causing lifestyle changes like alcohol consumption, smoking, and other stress factors that causes an increase in the ROS, that means the reactive oxidative species, that cause a lot of oxidative stress and result in the same procedure, the granulosa cell apoptosis and a decreased estradiol level. And that will cause defective oocytes as well as reduced growth and development of oocytes. So that is the way stress will affect the oocyte quality. Now, the impact of stress on the human endometrium. Actually, the effect is all the same. It is the hormones that are working, the estrogen and the progesterone. They are not being able to work on the endometrium properly as they should be working in a cyclic way. And that causes the endometrium to be very unwelcoming to the zygote. The lower GnRH levels, the lower FSH-LH ratios alters the secretion of estrogen and progesterone. It causes inhibition of the epithelial and stromal cell proliferation. It causes inhibition of the stromal cell differentiation. It alters the endometrial gene expression. It impairs the endometrial receptivity and ultimately affects the embryo implantation. So all these things are features of stress. Stress and mechanism of disturbed menstrual cycle has been talked many times before. The disturbance of the HPG cycle, the failure of the GnRH cyclic pulse, will not cause the proper cyclic changes in the menstrual cycle. And there'll be decreased secretion of steroid hormones, which will result in anovulation, and ultimately PCOS will result. And because that is also one of the reasons PCOS is also because of increased sympathetic innervation of the gonads. So these three things, the oocyte, defective implantation, and defective menstrual cycle, all of them are caused to a certain extent by stress. Now, after talking about the fact that stress can be one of the very big factors in causing failure or rather causing infertility, we have to now think about what impact does stress have on treatment. Because once the patient has come for treatment for infertility, she is already stressed. And in this stressful environment, we have to start certain treatments. And that itself is like a vicious cycle, causing much more stress on the patient now. And how is it proved? This has been proved by multiple studies which are carried out on couples, especially undergoing ART cycles, because those are the people who will come before the intercourse and before the ovum pickup. So we can actually have a study on them. And studies show that the stressor agents like cortisol and epinephrine have been measured in such subjects, showing clearly that stress plays a huge role in adverse pregnancy outcome. Cortisol has been measured in the hair samples of these patients, and it has been found to be increased in such subjects just before procedures like ovum pickup, or just before getting the injections of HMG, and when the husband is asked to give a sample of the semen. So at such times, when the cortisol has been measured in these subjects, it has been found to be increased. Also increased epinephrine, which causes increase in alpha amylase levels of the saliva in such patients. Both these things can be measured, and that's how we have realized and found out that stress is definitely very much increased in patients who are undergoing treatment. Now, after understanding that, yes, stress does have a big role to play, obviously we need to do something active for that. And that means we need to reduce the stress for such kind of patients. So what are ways to reduce stress? We all know about this because everybody's talking. Nowadays, particularly stress reduction has become a very big issue for everything, not only for infertility, for having a good lifestyle, for correcting so many diseases like hypertension and cardiac conditions and things like that. So ways to reduce stress are very important. There should be a very important curriculum of every prescription. The first thing, the most important thing, and the most easy thing to do would be talking. Patients should be encouraged to talk. And they should talk to each other, if possible. If they have a sympathetic family, they should talk to the family. And if they also have sympathetic friends, obviously friends are much better than family on many occasions, then they should be talking to the friends also. Just sharing their problems, sharing their grievances makes things much more better and much more easier to accept. Couple counseling, of course, is to be done by the doctors, if possible, or by a psychologist, professional psychologist who can tell them exactly, what is, how to deal with it. The third is the support group. Support groups are more interesting because a number of couples who have the same malady, that means infertility, if they come together, 3 or 4 couples, if they come together, they all may have different reasons for their being infertile, but the emotion involved is the same. So if they come together and they come to talk about their, how they're coping with the stress or with the problem of being infertile, I'm sure the stress, if not completely, will surely be decreased to a certain extent. Now, reading books on infertility is, of course, to be only given to those people who can read and are slightly educated to understand what is happening. But if reading, what happens is that you get an idea about your own physiology. You get to have an idea about your own anatomy. That is so important. If you understand where the problem lies, for instance, if you have the tubal block and if the patient can read and see a diagram about the uterus and the tubes and where the blockage is and why the baby cannot, why the ovum cannot come through that blockage, etc., she gets more balanced in her head as to what is the reason for infertility. So the stress factor may be withdrawn to a large extent if she understands her own system and her drawbacks. And the meditation, yoga, acupuncture, to sabhi karte hain for so many other conditions. So this can also be tried to reduce stress here. Avoiding excessive stimulants like coffee, alcohol, etc. Excessive stimulant always makes you very hyper, and hyper is not very good for stress. Hyper means that you'll get stressed out. In a very short while, you'll become stressed out. Exercising and following some extracurricular activities and hobbies. Again, this is just exercising keeps the mind, balanced and serene. And having some extracurricular activity, like any other hobbies, will just detract your attention from your problem, and you can concentrate on other things, and that way you can reduce your stress to a large extent. Now, we have been talking about these psychological and counseling and stuff, but there are some medical modalities to reduce stress. I don't know how many of us are using these medical drugs or modalities, sorry, to reduce stress, but they do exist. And we have just one or two few of them. So the first is melatonin. I'm sure everybody knows about melatonin, but we haven't been actively using it in much more in very regular treatments. It is a hormone which is produced by the pineal glands. It helps to control the sleep cycles, and so it relieves stress. More importantly, it is a very potent oxygen scavenger. And why is this important is because that stress always generates a whole lot of ROS and causes oxidative stress, which destroys those sperm cells and these oocytes and stuff like that. So if you can have an oxygen scavenger who will take up all these ROS and metabolize them, then nothing better than that. So melatonin has this great important activity of being a very potent oxygen scavenger. So it helps as an antioxidant and consumes all these toxic ROS, reducing oxidative stress. Supplementation with melatonin improves the pregnancy outcome in ART. I am not an ART specialist, so I cannot say this, but I'm sure there are some, or there may be some in the audience who can say that maybe they are giving melatonin as a part of their routine protocol, because this definitely increases pregnancy outcome in ART. Another drug, which has not really been, too much propagated, is Lactium. Now, Lactium is a hydrolyzed milk protein, which contains less than 1% lactose. So there's no fear of causing lactose intolerance in people who are lactose intolerant. It can be given safely to all people. It is natural and totally harmless in large doses even, with no serious toxicity or side effects. It can be used in all age groups and in active and athletic groups too, because it doesn't cause any sedation or any lethargy or any of that sort. Now, actually, when I'm saying in all age groups, it is very interesting to know the history of the discovery of Lactium. It came out from the fact that when babies are breastfed, after a feed, they go to sleep and they are sleeping for quite a bit, 2 to 3 hours without, in a very lovely, in a very peaceful slumber. Without any, of course, they have no worries at that stage. But even then, it looks at a very peaceful slumber. So the scientists all over the world, or at least in France, I think that is where they found this out. They realized that the digestive fluid of these babies, they have a certain enzyme which can convert the casein in the mother's milk into, a product that causes this kind of a very peaceful and very serene slumber. So Lactium is that product. And that is so natural and totally harmless that it causes no addiction, no sedation, no memory loss, and no disinhibition. So I guess it could be one of the drugs ideally that can be given for stress management without the fear of having any side effects or any toxicity as such. How does Lactium act? The mechanism of action, alpha-casein hydrolysate, or Lactium as it is called, it reduces the cortisol level, which is the main stressor agent, the main culprit of causing all the problems. So alpha-casein hydrolysate, it reduces the cortisol level and thereby reduces stress. It selectively binds to the omega-2 GABA receptors in the brain, not to the omega-1 receptors. And so it increases the activity of GABA or neurotransmitters which have an inhibitory action on anxiety and thereby produces a peaceful environment for the body, the brain actually. So Lactium can be used as one of the stress-reducing drugs in the near future. I don't know, we haven't yet heard about any particular products that have come in the market or people have talked about it, not yet, but maybe some special specialists are using this kind of drug. I don't know, I haven't been using it. Now, apart from the medical modalities talked about, there are some other time-tested remedies. Now, I am saying other time-tested remedies because these are not chemical drugs which are marketed by companies, medical companies that we know of. These are mostly plants and herbs and things like that, which many people who are, who have got another different type of mindset would say, what rubbish, this cannot possibly act on all these things. There are people, and anyhow, I am not, promoting these products, but I'm just mentioning it, that there are other time-tested remedies that can be used. One of them is Rhodiola roseo, which is a perennial flowering plant which is found in the cold Arctic regions. It is also called the golden root, as because the root of the plant has this medicinal value. And what is the value? It is used as an antidepressant widely in the European countries like Russia, and surprisingly results in enhancing fertility in women, where all standard fertility drugs have failed. This is what people over there, and it is just small talk in those places where it is being used. It is not established scientifically, but it is like ye bhi kar lo, so this also works, this also may work, that type of attitude. Anyhow, it is also effective in erectile dysfunction and premature ejaculation. So it can be tried where, just as an adjunct, where all other treatments are being carried out, you can also add these because the toxicity level of such drugs are not really very high, and they have not been, nobody has actually complained of the fact they are undergoing serious problems after having these drugs. They won't be called drugs after having these preparations. Okay. The next thing is our age-old Ayurveda, which suggests that Ashwagandha is a very effective antidepressant and also infertility drug, especially for male infertility. So this is a wonderful combination that we were actually looking for, an antidepressant as well as an infertility drug, because Ashwagandha does have the quality of acting for male infertility patients. It increases the blood flow throughout the body and enhances sperm quality as well. It reduces stress levels and increases libido. Thereby, it could help greatly, especially during the monotony of timed intercourse in the ART cycles. I guess that must be the worst form of stress that any couple has to go through. Have to run, and within a certain time window, they have to have an intercourse so that the ovulation, so that the sperm can catch the ovum and, possibly the pregnancy can result. So that I should think must be extremely monotonous and extremely stressful for any patient. So if Ashwagandha can help to a certain extent in that, then I guess it would be quite a good thing to try out. Lastly, we come to our favorite cup of tea, literally, because Ltheanine, which is a natural constituent of tea, has got an extremely good anti-stress effect. I guess because we all have the cup of tea so regularly, we're not understanding that we could have had more stress in our life had we not had that cup of tea. So we have all had stress or no stress, but in fact, now it is such a habit with us that if you don't have the tea in the right time, under the accustomed time, that will cause stress. But anyhow, jokes apart, the EEG evidence shows that L-theanine, which is the active or the natural constituent of tea, increases the activity of the alpha frequency band of the EEG, which indicates that it relaxes the brain without inducing drowsiness. I'm sure, because we all know that we are having a cup of tea regularly, and none of us feel drowsy after tea. In fact, we feel more active and feel more invigorated. So I guess a cup of tea is a natural therapy for patients who are undergoing stress. So this is it. The conclusion of this talk is this, that stress has a significant negative role in both male and female infertility. Treatment of infertility further will cause stress, so we need to break the cycle somewhere, somehow. All infertility management protocols must, therefore, in my opinion, include a prescription for stress busters, which could be vocal by us as treating doctors, if we can give the time, or by professionals, counselors, because there are plenty of counselors. We can always refer the patients to them. And they give a lot of time. They give nearly 1 to 1.5 hours for each sitting. And I guess a lot of, hearts will open to them, and a lot of secrets of why the infertility is happening can come out by professional counseling. And the physical methods of yoga and meditation, exercise, as we have already discussed, and the medical methods of melatonin and Lactium, as we have all discussed. So here's the end of the talk, and thank you all so much for a patient listening. I hope it is interesting. It was an interesting talk, and I would love to have some feedback on this. Thank you all.
Thank you very much, ma'am, for this nice deliberation. Just give me 1 minute time, ma'am, to check any questions there. So, ma'am, one question is, as you convinced that stress is a very important factor that need to be addressed in case of this infertility treatment. So what is your recommendation? How do you, what is your approach to treat the infertility in terms of stress management?
Yeah, but I told you, I was talking about it actually, that if you can be more observant, and if you can diagnose even a small little bit of stress, teensy bit of stress in a couple when they come for, the treatment of infertility, as I told you, the physical methods are the most, talking, first of all, the talking is most important. Us talking to them, they talking to each other, talking to the family, friends, and ultimately to the counselor might help to a large extent in decreasing the stress factor. And even after that, if you think that medicines may be required, then as I said, that we have a certain drug called Lactium, which is coming up now in the medical circles. And if we have certain preparations of Lactium, then I'm sure we can give them, because it is non-toxic, it is non-habit forming, it will not have any side effects on any particular activities of the patient. So I guess Lactium would not be a bad choice for the stress correction.
Thank you very much, madam. And another question is, madam, how do you feel that melatonin? What is means?
Yeah, I was telling you, I have no experience of melatonin. If the IVF, if the ART doctors in the audience can help in this respect, please. If you all are giving this drug to patients anyhow, then I would love to be enlightened. Anybody who can talk about this?
Just to share with you one information, madam, just a few days back, I was going through a research article, and that was showing that means amount of melatonin, if it is higher melatonin deposition, then there will be a less chances of conception. So I have that research article also. I will share on that too.
Okay, then I guess there must be some standard dose if melatonin is given. See, I just talked about the properties of melatonin in decreasing stress. I don't know whether it has actually been given as a drug to patients, but there are so many chemicals that have got properties, and then the drug companies will come forward with some formulations that can be given as a dose to patients. So if melatonin can be used as a drug to give to patients, and when they are saying that melatonin increases the outcome of pregnancy in IVF, then I guess there must be some doctors must be giving this melatonin in some form or the other in these IVF centers. I'm not aware of it, but that's what I'm asking the audience. If anybody is doing it, so please come forward.
Just 1 minute. Just give me 1 minute now. So thank you very much, ma'am. I could not find any other question. And lastly, I want to thank you so much for such a nice deliberation, and particularly highlighting this impact, this stress impact, and how it is affecting this infertility, and especially to focus on this lactium, which can be an alternative to stress management also in case of your infertility treatment. So thank you very much. It was a nice session, and thank you once again for your valuable time on our platform to discuss such a nice topic. So thank you very much, ma'am. And in future also, we'll be very happy to organize such a nice session on some other topics, some very important topics in case of gynecology and infertility in future. So thank you very much, ma'am. Once again.